I'm Dr. Demetrio J, Aguila III, and I am the host of the Direct Care Movement podcast, a podcast where we discuss all kinds of stuff relating to healthcare and medicine and money, two things that we commonly don't want to talk about together. We're going to cover questions that you've wanted to ask, but were afraid to ask or didn't know who to ask, questions that maybe you didn't even know you wanted to ask until you heard them on this podcast today. We're going to go over that and a whole bunch more, and we're really excited today to have Colton Storla as our guest. Thank you for joining us, Colton.
Yeah, thank you.
Colton, why don't we start by having you introduce yourself and tell us a little bit about yourself?
Yeah, no problem. Just a small town guy from Cedar Rapids, Iowa. Born and raised here. Was multi-sport athlete growing up. Went to college and studied physical education with an emphasis in strength and conditioning. Did some psychology as well, but I was kind of on that path of wanting to become a strength and conditioning coach for college athletes. Just had a really good experience after college and playing football and my academics there, but ended up going to the University of Iowa after that and trained with the Iowa football program there under Chris Doyle. Great experience, great culture, learned a lot. I don't discount my time there because I learned a lot personally and professionally, but ultimately hit a crossroads of what I wanted to do in my career. And through a lot of just soul searching and talking with mentors and other individuals, a guy that I had a lot of respect for, that was my mentor throughout my freshman year and all the way through college. He suggested I ask this gentleman named Greg Dunn for a job. And I knew this gentleman because I did some odd job work for him throughout college, and his wife was actually one of my psychology professors. So I knew both of them, knew they were great people. However, I just didn't really know what he did. And it turns out he was an employee benefits consultant. And so right after college, basically, I wasn't even licensed in health and life. And he did end up taking a chance on me, knew I was a hard worker and could talk to people and things like that. So got licensed and worked for that organization for 3 years. And then we were acquired by a larger agency. So been in the employee benefits world for about 8 years now. But quickly got, I was perked, or I guess I was more intrigued on the, health insurance side of things, because that's where a lot of the conversations were about. As I was meeting with employers, it's where, the most dollars are when, comparatively to dental, vision, disability, life insurance, things like that. And I also quickly realized I wasn't everybody's best friend every year when I had to go and present, renewal increases with their, big health insurance carrier. And, really the only way to, my job was to try and, quote all the options for them and give them kind of the least bad renewal option out of all the options that were available. But quickly realized it wasn't a sustainable model. When you're faced with a renewal increase as an employer, what do you do? Do you raise deductibles? Do you put skinny networks in? Do you ask the employees to pay more? Do you let the increase eat into the profits of your organization? And that just was not, sitting well with me. So again, I, started to do more research, and it's like, there's got to be a better way, and started getting connected with different organizations and things like that. And now I'm kind of on a path of doing things a little bit differently against the grain. And the results are showing with some of my clients that are wanting to do things differently.
That's awesome. So, as you know, our target audience here is medical students and residents and fellows and people who recently graduated from their training. And I've been involved in these conversations regarding employee benefits for a number of years now. But I would imagine that there are a lot of people in our listening audience here who heard what you said and said, "Holy cow, that sounded a lot like Greek, Swahili, and maybe some Russian all mixed together."
Yeah.
So let's talk about let's talk about health insurance or health benefits, and I think a lot of people conflate those two. They say, oh, well, those are the same thing, right?
Yeah.
Or like this idea that healthcare and health insurance are the same thing. Walk us through that a little bit. Well, what do you mean when we talk about health insurance versus health benefits versus health care?
Yeah. Well, I mean, from an employer perspective, they offer employee benefits to recruit and retain. And, majority of people in the United States get their health insurance through an employer. However, employers are super well versed in, employee benefits and insurance. They rely on folks like myself to be the expert and, kind of get super ingrained in their organization, their philosophy to try and, bring those options to the table so that then they can present that to their employees. And that was one other thing that, I quickly realized, I was speaking Greek, during employee meetings because, employers are paying a lot for these benefits and you need to have open enrollment educational meetings so then people understand what they're buying and they can use it to the best of their ability. But for the most part, in the healthcare side of things and, health insurance, all they really know is I've got this card. I present it at the window at, name the facility, and I don't know anything else. And I'm putting full trust in my insurance company and I'm putting full trust in the healthcare provider that I'm about to see. And so that's one area that we're spending a lot of time is the education piece that not all carriers are created equal, but not all physicians or facilities are created equal as well. So, kind of getting that mindset of, how can we create this kind of like an Amazon shopping experience where you can go on, compare cost and quality metrics, and then be an informed consumer to then, purchase healthcare in that way versus I know I'm sending a bunch of money to my health insurance carriers. They dictate, who's in network, who's out of network. They dictate what the reimbursements are to, the physicians and the facilities, which I work with a lot of other healthcare providers that, they don't like that because it's just a game of discounts and reimbursements and constant fighting. And at the end of the day, it ends up inflating the cost of health insurance and lower reimbursements for someone that's trying to have a practice in their community or wherever else. But yeah, any questions based off of that or where you'd like me to expand?
Well, sure. So, I think there's this idea among many people, whether it's patients or physicians or I mean, even employers sometimes, that health insurance equals healthcare, right? That those two are the same thing. Well, I have my Blue Cross card or my United Wealth Scare card or whatever it is, and that gets me in the door.
Yeah.
But it occurred to me recently that people want that sense that they're gonna that they have purchasing power when they show that special card, right?
Yeah.
Effectively, it's kind of like having a Mastercard in your pocket, right? But I
Yeah.
don't think there's anybody out there that thinks, well, Mastercard actually pays the bills, when I buy that TV. I mean, who's
Mhm.
buying the TV?
Yeah.
Yeah, I'm
That's
buying the TV, not Mastercard. Mastercard just happens to be the vehicle. But I think a lot of people think, oh well, if I hand them my insurance card, well, then the insurance is paying the bill. Well, who's really paying the bill?
Yeah, and that's a really good point because one area that I'm trying to spend, a lot of my time when I'm getting into employee meetings, and trying to flip that mindset as, the person that's covered under a health plan because everybody's so quick to say, well, my insurance paid for it or my, whatever. And it's like, well, don't you pay insurance premiums? Don't you pay a deductible? How long have you been paying those insurance premiums for? 10 years, 20 years, 30 years? Well, your employer's also paying a portion of those premiums. So as costs go up and they're asking you to pay more, or the company's eating that cost. Well, if the company's eating that cost, that's probably taking away from wage increases that you could potentially be getting because that insurance carrier is constantly increasing your insurance costs.
Sure. And so then, the question then becomes, and I hear this from patients all the time, and I also hear it from employers. Well, but healthcare is so expensive. I mean, it costs, tens of, maybe even hundreds of thousands of dollars to get, surgery X done. How else are we supposed to be able to do this? How do you answer them?
Well, again, goes back to my comment on the, insurance carriers over inflating the cost of health and health care, with these, with the provider community. And then all they want to do is be able to send you that EOB that shows, a 50% discount. Well, it's like 50% discount off of what?
Right.
So, a lot of those conversations about, with employers is, I've seen hip surgeries as high as $125,000. I've seen hip surgeries as low as 25,000 or even 20,000. And, then it's not all about cost, because we always want to, couple that with, with, gosh, why am I drawing a blank? Um, Outcomes and just
Mhm.
complication rates and, overall value, high quality, low cost, and not just hammer at, low cost, because then, a joke that I heard recently, it's like, we're not sending you to, Joe's tattoo parlor and knee replacements. We're trying to find, the highest quality physicians for, hips, knees, shoulders, hands, whatever. And usually they're the most, they're the ones that are adopting, the latest practices, the efficiencies. They've got cash pay options for people that aren't, astronomical.
Sure. Now you hinted earlier at this idea that maybe insurance wasn't the best option. Now, to the average person on the street, that sounds like heresy. Like, what are you talking about? I mean, how am I supposed to get any kind of care if I'm not using insurance? And
Hmm.
you kind of pointed to or alluded to a different way of doing things, a different way of cracking that nut, so to speak. Tell us more about that.
Yeah. Well, I think, one point I want to make, and then I'll kind of loop back to that question is, as, costs continue to rise and deductibles continue to go up, employers are saying, this just happened at a local school district. They're like, by popular demand, we're adding a high deductible health plan with an HSA. And, it's not popular. That's, I think what employers try and make you think, because as deductibles go up, well, what we see is that now a barrier to care, because people will go to the doctor's office and then they get the bill after the fact because they don't know what the cost is. And then they're like, oh no, I'm not doing that again. And so then it's delay, delay, delay. And then you might have to resort to the emergency room, or it's delay, delay, delay. You're going to be hospitalized. Or do we just remove barriers to care, in a different manner? So then people, as soon as something comes up, they're not even going to think twice about going to the doctor's office. But, to kind of loop back on your question, I had actually a real time example for myself on, my insurance, and we have a little bit different plan than most employers. But I got diagnosed with basically a hip impingement, and I needed to get an MRI to confirm that my labrum was torn or not torn. And I was at a university hospital for sports medicine, because that's who my physical therapist referred me to. Best hip surgeon, here in Eastern Iowa. And so they wanted me to get an MRI, and I asked them what the cost was going to be. And they said, well, I don't know what the cost is. You can, use this link or go online and do a cost estimate. And that was going to be a $3,200 MRI. So, I'm an informed consumer. I called around to an independent practice, and I did an online submission to what is this going to cost if I funnel it through my insurance or my PPO discount? And then put a second submission on what this would be on a cash pay basis. And surprise, surprise, it was about 750, I believe, through my insurance. And they actually quoted me 950 through cash. So I picked up the phone and I called them. I said, you guys are charging more for your cash option than going through the hustle and bustle of having to submit that to my insurance and then get reimbursed. I'm like, oh no, that must be an error. We'll just match what, your insurance price would be for cash. And I was like, okay. Well, then thirdly, I called my direct primary care doctor and I said, "Hey, I got to get this MRI. This is what the cost estimates that I've gotten." He goes, "Oh, well, I can actually get that for $350." So it's just like we started at 3,200, now we're at 350, and the same thing happened when I actually had to go get the surgery too. We started as high as $30,000 for physician and facility fees, and ended up actually getting that 100% paid for by my health insurance company, just because I went to a higher quality, low cost provider at the end of the day.
Sure. Well, I remember, I mean, speaking of personal experiences, I mean, I remember this is probably about 7 or 8 years ago. I needed an MRI of my shoulder. And at the time, I was employed by a hospital. And so I figured, you know what? I'm a doctor at this hospital. They'll take good care of me, and they'll make sure that everything's taken care of, right? And so I got this MRI of my shoulder, got it done at the hospital. I was referred to the hospital by the doctor that ordered it. And it was a $5,000 MRI of my shoulder, no contrast, right? And my insurance company, which supposedly was really good at the time, paid $1,500 of it. So I paid $3,500 for my $5,000 MRI, and of course I was relieved. I was like, wow, that could have been a lot more expensive, right? Then a few months later, a patient of mine came to see me for something completely unrelated. And he said, "Oh, doc, am I going to need an MRI for this?" I said, "Yeah, you are." And he said, "Oh, I don't like MRIs." I said, "Yeah, I don't blame you. You spend a lot of time in the machine." And he said, he goes, "Well, yeah, they're expensive too." I said, "Oh, yeah, no kidding, they're expensive." He goes, "Yeah, I just had my shoulder MRI done last week, and it was $495." And I was like, "How much did you say?" And he said it was $495. And I said, "Well, are you sure it was an MRI and not a CAT scan or an X-ray?" He goes, "No, it's an MRI." He says, "Go ahead and take a look at my medical record. You could see what it showed." And I said, "Okay." So I pulled up his medical record, and it was an imaging center across the street from the hospital, right? And same model MRI as the one that I had been in. It was the same radiologist who read the MRI, but he
Wow.
had paid cash, and it cost him $495. But I, on the other hand, got to pay $3,500 for the privilege of using insurance.
Yeah.
So that was one of the things that kind of tipped me off. You know what? Something's not right here. So tell us more about this approach that you have, which is which you use in your role as a benefits advisor, to help employers and employees get better care at a lower cost.
Yeah, I mean, the employers or benefits purchasers, they think that if you're buying that big name brand carrier option, that you're going to get the greatest access, you're going to get the greatest discounts, therefore you're going to get the greatest health care. And after educating an employer on my philosophy and how we approach things, it kind of gives them that aha moment, because there's very the employers, um, you know, um, you know, I guess what they're trying to accomplish, lower cost, better benefits, do not align with the insurance company's philosophy. They're trying to raise costs, therefore that raises their profits, because a lot of them are publicly traded. So it's just not a good, partnership or alignment at the end of the day. So I talk to employers about how can we build a health plan to benefit you and your people, so we can keep as much dollars within your four walls as possible, so that your employees and their families can get the care that they need with no financial burdens at the end of the day, and they're being directed to high quality, low cost providers. And so um, a lot of what I do is not just meeting with employers, it is actually meeting with other folks in the healthcare realm. And a lot of it's the independents, because if I try and have some of these conversations with some of the larger behemoth hospitals, they're just not interested, because chances are it's against their interest as well. So working with the independent, community, the facilities, the physicians, the radiology, and kind of bring everybody to the same table and having these conversations, because in any given community there's healthcare providers, there's facilities, there's businesses, and there's a benefit program that's being offered. So why not bring everybody to the table and say we need to make a mutually beneficial arrangement between everybody here for the betterment of our community, the betterment of our people, their families, their healthcare needs, so on and so forth. And how can we try and remove all the misled interests of the insurance carriers as possible, or any other vendors that might be included? Because pharmacy is a whole nother animal, and so how can we again bring everybody to the same table and make this work for everybody? Because the employers need benefits, they've got people that need healthcare, and then the healthcare providers, they need people walking in their doors seeking services, and they're trying to compete with big systems, and so trying to make that a mutually beneficial arrangement, and then just driving as much volume to that facility as possible
Sure.
when necessary.
So walk me through that. So let's say, we're talking to somebody who's about to graduate from their residency. They're going to be opening up their practice this upcoming, July or August. And they're trying to figure out, okay, well, what do I do? I mean, how do I work with somebody like Colton? What does this process look like, and how does it differ from your conventional approach where Dr. Joe Blow says, okay, I'm gonna reach out to this credentialing company, and they're going to get me credentialed, so to
Yeah.
speak, with all of these different insurance companies, and the insurance companies are going to give me money, and I'm going to see patients. how, how does what are the mechanics, what are the steps in the process that you're describing that are different than what I just described?
Yeah. Well, I think, if you are an individual that's, going to be graduating, starting your own practice, or you're part of an independent practice already, and you're trying to, get more patients within your facility, I can speak to this on two separate sides of it, because I do a lot with direct primary care doctors. And I'm very passionate about direct primary care because it's a completely different model than the fee for service primary care model, where you have to see, 2,500 patients, 3,000 patients. It's your panel size. You need to see 40 to 50 patients a day. And at the end of the, 7-minute visit, you're just probably being prescribed a new medication. I'm super passionate about, diet and exercise, and, there's always the time and place for that. But having that time with the doctor and being able to actually talk about your healthcare needs, your chronic conditions, your anything and everything, and how to get actually better versus just being prescribed another medication. So I work with a lot of direct primary care doctors that they are also trying to get into the employer space, and a lot of them have already had meetings with employers saying, hey, this is a different type of care model than the fee for service. And a lot of times they might already have the executive as a patient of theirs, of this organization. And it kind of falls on deaf ears, because they're like, hey, doctor, I understand the value that you could bring to my people, but I'm paying so much in health insurance costs right now. That would just be an additional cost on top of a cost that's been going up for the last 10 plus years. And so that's the value that I bring, being able to, again, sit at the same table as that direct primary care doctor. He can speak to the healthcare delivery side. I can speak to the insurance and everything else, because, on average, they're going to be able to treat at least 83% of any of those healthcare needs for their people. The other 17% is going to be the big stuff, the specialty, the surgeries, the oncology. So how can we couple that with a major medical health plan and have the direct primary care work in a cohesive manner? And oftentimes that's talking about, self-funding, working with an independent TPA or third-party administrator, not a big health insurance carrier. We can still, have a pharmacy benefit manager. We can still offer you a PPO network, but we're going to try and create incentives within that health plan for people to use the direct primary care. And oftentimes we're saving the company so much that it's actually paying for the memberships at the end of the day, because we're saving, 10, 20, 30% in premium spend. And then the same thing when I talk to, the independent orthopedic groups or independent radiology groups, oftentimes they don't own primary care. So they rely on people to walk within their doors or their marketing or things like that. Because if you catch yourself in a big system with primary care, they're just going to funnel you within their system. Go down the hall to our radiology or go down our hall to, orthopedic or PT or things like that. They're not going to say, hey, I know you can get that MRI across the street at one of our competitors. Why don't you go over there? That just doesn't happen. So again, building a plan that includes, these independent orthopedic groups and setting up, their own fee schedule that, whatever they need to make off of their services, working with a third party administrator that can, actually, handle, like a direct contract or a bundled surgery agreement, so that then when I'm communicating to the employees or to the employer saying, hey, we've got this independent practice, high quality, low cost. Let's try and, incentivize your employees and their family members to go to this facility versus the big system, because we know it's going to be a lower claim to the health plan. And let's make this a mutually beneficial arrangement because your health plan is saving. So let's make it so that the employee also saves. So we can say, hey, employee, if you go here, we're actually going to waive your out-of-pocket costs completely.
Sure. So now you've mentioned a number of times saving money for the employee, saving money for the employer. So that money's got to come from somewhere, right? And so what's the benefit to the physician of getting involved in an arrangement which saves money for the employer and for the employee?
Yeah. I mean, usually when I'm talking to employers about these types of arrangements, they need to be in some sort of like self-funded or partially self-funded or level funded arrangement, because they get unlimited access to their claims data to know what they're spending today. And then we can kind of bounce that up against, like, well, if this person would have went here, or if they would have picked up this medication or did this or did that, this is what the overall savings would be, to articulate that to the employees or to the employer and say, there's a real benefit here. So you just got to structure the plan appropriately, so that we're getting people to, those independent orthopedic groups, independent gen surgery groups. And by removing, the insurance portion, setting up that fee schedule with the physician, and then at the end of the day, we're probably able to drive more volume to that provider or that facility, so that they're making, good money at the end of the day.
Awesome. So I want to shift gears a little bit here, because I think we're talking about concepts here and ways in which we apply them. But just as well as I do that recently, and I don't know when this episode is going to go live, but right now, today, there's a lot of buzz around what happened to the CEO of United Healthcare.
Hmm.
And there are a lot of people who are expressing some significant frustrations with United Healthcare in particular, and also with health insurance in general and how that works. And some people speculate that this might be a turning point in the industry. But what I want to ask you is, about these frustrations that people seem to be talking about. Um, you know, there are people out there, and I certainly am not one to advocate vigilante justice or anything like that. As much as I like reading Batman, in the real world, that's not how things work. And so there are a lot of people out there that are really frustrated with their healthcare and with their health benefits, and everything that's happened with United Healthcare recently has kind of brought that to the fore. What's your take on that frustration and on the kinds of reactions people are having to the death of the United Healthcare CEO?
Yeah, I mean, it goes back to misaligned interests. I mean, that particular organization is a publicly traded company, and it's their job to return a profit to their shareholders. And so that's going to be at the sacrifice of something. And, they're making a good chunk of money off of, government arrangements and employer arrangements. And I know there's been a lot of buzz about, they deny a lot of claims, and they're creating a lot of barriers to care. So I kind of just wonder, what the conversations they were having around their boardrooms, prior to this incident, because it was probably like, how do we drive as much revenue as possible? And so you wonder, after this incident, are they going to say, hey, we need to do things differently? Or do we not make as much of a profit? Because I think they just reported, 6 or 8 billion dollars in their last, quarterly, earnings discussion, and yeah, you just wonder. So unless they're willing to change, I'm going to continue to place business elsewhere, because I work for my clients at the end of the day. I don't work for, an insurance company, and I'm going to do what's in the best interest of the client. I'm going to do what's in the best interest of their people. Yeah.
All right. So, in an ideal world, if you were emperor, what's your solution? How do you make this better? Like, where are the pain points, and how do you solve them?
Again, just going back to, being passionate about just health and wellness, and, living that healthy, lifestyle. So I really, encourage everyone to seek out, a direct primary care doctor to get the care that they need. Because usually when I talk to employers too, I say essentially there's 4 areas within your health plan. You got primary care, you got outpatient, you got hospital, and you got pharmacy. Those are the 4 areas that your claims are, being allocated to. If we can lower your claims, we can lower your premiums. But the most important piece is that primary care piece, because if people are engaging with primary care and taking care of themselves, they don't want to hear me telling them, hey, you need to, eat this or do not do that or do things like that. But I mean, coming from a doctor that's, spent a lot of time, learning about all these things that you should and shouldn't do, with good primary care, that's probably going to mean, less surgeries. That's going to mean less prescription drugs that you're on. That's going to mean less hospitalizations. I mean, we're seeing it in the data that as obesity rates go up, well, guess what? MSK is going up. More knees surgeries, no more hips, more back surgeries, because people are carrying around more weight, and they're taking more prescription drugs, and there's side effects with prescription drugs, and the cost of prescription drugs, if people aren't taking them as often as they should, their adherence goes down. Well, then what happens if their adherence goes down? They end up in the emergency room, or they end up being hospitalized. So a lot of the direct primary care doctors that I am, working with, they're talking about, reversing disease. And so direct primary care, definitely one of my favorites. But secondly is, again, partnering with those independent physicians and facilities, trying to get them into an arrangement where they can come up with a bundled surgery. So we have that transparency, and we've got, the quality metrics oftentimes, in creating that kind of Amazon type shopping experience, because there's nowhere in our world that we consume anything in the manner like we do with healthcare today. Black Friday was just, however many weeks ago, and you can go into Walmart, Target, Best Buy, and look at all of the different TVs, and you can go online and look at reviews, and you can look at the price prior to purchase. Same thing when we go to the grocery store. We don't shop for our groceries, load up the cart, walk out the door, and then the grocery store sends us a bill, 3 weeks later. So again, trying to work with the independents to, drive volume to, those types of facilities, because we've seen the quality metrics. We know it's higher quality in most cases, and we've got that transparency into pricing. And at the end of the day, if we can, empower our employees or Americans with that information, then it's the free market. They get to decide on their own healthcare and how they want to purchase that.
Awesome. So as we tie up here, I want to ask you the same question that I ask every single one of our guests. All right. Um, Keeping in mind that our target audience is primarily medical students, residents, fellows, people who are in training or just about finished with their training or recently finished with their training. What is your takeaway for them? For people that are thinking about doing whether it's direct primary care or direct specialty care as an independent specialist, what is your advice? What is the one thing you want them to know that they can do to make things better for themselves and for their patients?
Yeah, I mean, I'm in, the part of Iowa where we're dominated by the University of Iowa, and they're a big name. They are sponsor a lot of things. They do a lot of great things, but then not too far north is Mayo Clinic, and so I went to, a school where our nursing program was pretty top notch, and I think, for my nursing friends, they always thought, well, I'm going to graduate and work for, the big name brand. And turns out it's not all sunshine and rainbows when you get into those big systems, because again, a lot of them are driven off of, profitability, and it takes away from, patient care. And so, again, with some of the direct primary care doctors that I work with, a lot of them have similar stories where, hey, I graduated, I went and worked for a big system, I realized that there's a lot of misaligned interest. I got into this, type of work because I want to care for people. I'm sure there's some financial, pieces to that as well, but it's just the burnout. I mean, that's the buzzword that we're hearing, not only in, any other job profession, but especially in healthcare and, teachers and things like that. So I would just ask yourself, why are you getting into medicine? Is it because you want to care for patients and you make a pretty good living? Then, you know, one thing that I didn't do is do enough job shadowing and talking with people prior to getting into the working world. And so I'd encourage anybody, I know there's clinical programs that you're going to do. Well, maybe, choose one of the big systems, and then maybe, choose one of a smaller independent, facility so the differences by both sides. And then, at the end of the day, pick the option that, is most aligned with what is going to, fill your cup at the end of the day.
Awesome. Any other last thoughts or bits of advice for our audience or anybody else for that matter?
Just read and pay attention, and healthcare is that, there's it's full facet. It's hard to keep up even just from, my side of things. And so that's why I like to engage with folks like yourself, because I don't know everything. So network, get out there, talk, get on LinkedIn, read, just, engage and apply yourself, and, have these conversations.
All right. Well, thank you, Colton, for joining us today on the Direct Care Movement podcast. We're excited to have you on board. And if there are any of you out there who really liked what you heard today, share this with a friend of yours. Talk to somebody about it. Don't keep this a secret. And make sure if you're listening or watching on one of the platforms where you can do this, click like click like and subscribe, and share the word. Spread the word, and don't keep this a secret. We can make a difference. We can make healthcare better. We just need your help to do it. Thank you for joining us on the Direct Care Movement podcast. We're excited that you joined us, and we're looking forward to having you join us in future episodes as we dive into more questions and more concerns and more solutions in the direct care space, whether it's direct primary care or direct specialty care. If you liked what you heard and you want to know more, please click like and subscribe and leave us a review. And don't be afraid to reach out to us directly so we can get you more information about direct care, whether it's direct primary care or direct specialty care.